In Liver Talk today, we're going to talk about acute liver failure. Acute liver failure is basically liver attack, quite like a heart attack or a brain stroke. It affects the person just suddenly over a matter of few days. A person who's perfectly well and healthy before is suddenly affected by acute liver failure, which is usually due to hepatitis E or hepatitis A or hepatitis B in adults, and a disease called Wilson's disease, which is basically copper metabolism gone wrong because of an enzyme deficiency in children. And what happens in this is that the person suddenly gets deep jaundice, starts to develop coagulopathy, which basically means bleeding tendency, and slowly goes into a confusional and drowsy state, and then goes on to pre-coma and coma. Now, such a person obviously needs to be referred urgently and cared for in a liver service or an advanced liver disease center. Some of these patients can actually be treated medically and they get well over a matter of few days to weeks, but a large number of them need an emergency liver transplant to cure them. Otherwise, they would lose their life. At Medanta Liver Institute, we have a special rapid response liver failure team where we receive calls from patients' families, referring physicians and hospitals from all over India and even abroad, and transport these patients by air or road ambulance as appropriate to our liver service, where they can be cared for in a specialized liver ICU with medical treatment, or we proceed for an emergency liver transplant if necessary.